We're having this conversation now because I think it can't be a minute too soon. I think we have seen the changes coming for some years now, but actually things aren't getting any better. We know that children should move. We know that children should be outdoors. We know that children should be active. We know the benefits of sport, both mentally and physically. We know it impacts not just on their physical health now and their mental health now, but their future prospects, even employment prospects. But somehow we're not cutting through.
I'm Dr Paula. I'm a medical doctor, author and broadcaster, and my real passion is to support people in their own lives with their health and well-being.
I'm Dr Tom Rance. I am a paediatrician and a children's health researcher at the University of Cambridge.
My name is Paula Franklin and I'm a doctor. My specialty was public health, but I also spent 9 years as a trustee of the Youth Sport Trust.
My name's Oliver Mitten. I'm a public health doctor and I work at the UCL Great Ormond Street Institute of Child Health. I joined the Commission because I'm concerned about the future of our children's health.
One of the things that was really important in us heading up, in us creating the Commission and the class of 35, was the understanding of the complexity of the issues facing children and childhood today. And at the Youth Sport Trust, naturally, we focus a lot on activity, play and sport, and a lot on school. But I was also very keen that there's an opportunity for a healthcare and a medical voice to be added to that. And I think that could strengthen our messages and our demands and our representation, really, of the needs of children.
I see a lot of, a prevalence or an increase in the amount of children and young people who are struggling, particularly with their mental health and their emotional well-being. That might be loneliness, not being able to connect with others, anxiety is a big issue, and also body image and self-esteem. It seems to be there's a real rise in that, as well as parental concern around that as well. I think also that sense of self-esteem and confidence, I'm seeing a big upsurge, I think, in young people and children feeling like they don't quite know what to do to get those skills, or they haven't got the resources to enable them to do what they want to do in their future careers and their future lives.
I don't want to overstate too much how much physical activity is important. It is not a panacea of all children's ailments, but I think we are increasingly seeing that children's health fundamentally is being left behind. We live in what is objectively quite a flourishing society by many metrics, and I think actually with children's health we see the opposite.
So there's two big trends that concern me. First is the rise in obesity, and second is the rise in mental health conditions. We tend to see these as separate trends, but they share some of the same underlying drivers and causes. The Chief Medical Officer's guidelines recommend that children aged 5 to 18 years should be doing 60 minutes of physical activity every day. Children aged 1 to 5 years, so preschool and toddlers, should be doing 180 minutes of physical activity every day. So we're seeing two challenges at the moment. One is children don't have the same opportunities to be active outdoors as they used to have. But at the same time, we're seeing this pull bringing children indoors. And that's about screens and devices, which have been engineered to be very addictive and attractive. And so these twin challenges are reducing children's opportunities to be active, to play and to interact with other children in a more normal way, which is so important for not just their health and well-being, but regulating their emotions and learning how to interact with other children and adults.
All of us are living busier lives, a faster speed and faster pace. So I think parents, carers, all of us adults that are surrounding those children and young people are finding it harder to create the time and space and resource to be able to do things with their children and young people, to encourage them to be role models for them and to find time and space for ourselves to do that alongside them.
The rates of child mental health referrals have skyrocketed in the last few years. And there is a huge number of reasons why that could be. We know that physical activity does have an impact in their development. And if your physical health is affected, so is your development, so is your future mental health.
I think this conversation is long overdue. Some of the changes in children's physical activity have been going on for decades.
Adolescents are having more mental health problems. Have we put too many restrictions on adolescents going out and enjoying themselves in a free, unstructured manner? Are we preventing them from going out into the wilderness and exploring for themselves? And I think all of these quite soft things do add up to a mental resilience that I think is really important, that has perhaps been left behind somewhere in recent years.
So one story's really stuck in my head of how children's physical activity levels have changed, and it's the story of a family in Sheffield, 4 generations. And the great-grandfather, born in 1926, he used to walk 8 miles to go fishing in the woods. The granddad, born in 1950, he used to walk 1 mile to go and play in the woods. The mother, born in 1979, used to walk 1/2 mile to go to the local swimming pool. And the son, born in 2007, was only allowed to walk to the end of his road, 300 yards.
We are seeing an increase in the numbers of those children being referred, whether that's the well-publicised waiting lists for autism diagnosis, or it's a more fundamental developmental issues.
And some of the experts on the commission were telling stories that were quite horrific to me. Children that have never, from being a baby, have never learned to turn over, have never been placed on their stomach, so they never learn how to lift their head and don't gain the strength in their back and the back of their neck to lift their head. Children, indeed, that have flat heads. I know that sounds extraordinary, doesn't it? But because they're laid on their back for so long and never lifted up and never brought out of their cots and never stimulated, they don't develop properly. They don't develop as human beings should. And all of this can be prevented simply by really allowing children to move in the way that they naturally would want to.
So one of the things that really surprised me was hearing some of the stories from my colleagues who work with younger children on a day-to-day basis, and how children, when they come to school, their hands have not developed with sufficient strength and dexterity to hold a pencil. And they're no longer able to engage in learning activities at school because they haven't had their hands haven't been used in the right way. They spent too much time on screens, and their hands and bones and muscles aren't developing in the right way.
I was taught as a medical student that type 2 diabetes was a disease of middle age. Didn't happen in children, so you don't have to worry about it. Now, of course, we are seeing children with type 2 diabetes. This was unheard of when I was training. It just didn't happen. So what we're seeing now are conditions in childhood, earlier and earlier, that just should not be happening and that are entirely preventable.
Children ages 0 to 4 have been really left behind. Children, by the time they get to us in clinic, often it is too late to intervene in a preventative manner. But what I know that lots of my colleagues would prefer is that they never see us in the first place, that we try and do something before they reach that stage of neglect to improve their development. And I think play, physical activity, movement are the key to understanding and preventing lots of those behaviours.
So I think one of the great concerns if we don't do something is obviously the state of children's and young people's health, physical, mental, emotional, but also their social skills. That generation of children and young people are going to become adults. They're going to become the population that is of the majority. So, there are real risks there to deterioration in physical health, chronic illness, incidents of chronic illness being much more prevalent, difficulties in relating to each other, and that's really concerning. It's really harrowing. But also, what's more important about that, I think, is that it is preventable, and it's something that we can actually change and stop from happening. And that's why it's so important in terms of this commission.
What will happen is that there'll be even greater pull and draw and requirements on the NHS. There'll be even greater challenges in the education sector if we don't do something about it now. And government is the key where all of this comes together.
It would be very easy to put responsibility for this on parents, but the government has got such an important role here to create the opportunities, providing safe play spaces, streets that feel safe for children to walk and cycle to school, and regulating these very addictive devices. Parents struggle to manage their own time on devices, so it's no surprise again a struggle to manage children's time on devices. So there needs to be some sort of regulation to help children and to help parents manage their children's behaviour. So for the Commission, it was very important that we suggest government systematically measures children's well-being.
And I think if we do not think more holistically about children's health, we will have defined children by their economic output rather than have they had what most of us would consider a fulfilling childhood.
So my real message that comes out of the Commission is that we need to act, and we need to act now. There's been enough talk, we know the evidence, we've heard the impacts of not doing this and what that's been. So the real message is we need to take action. Every single person involved with children and young people needs to take their part in that action.
To paraphrase Chris Whitty, there is no situation, there is no age and no condition where movement is not a good thing. For me, this quote says everything about why movement and physical activity is so core to the practice of medicine. It's so influential for so many conditions, both in terms of prevention and treatment.
I am hopeful that the messages of the Commission and indeed of the healthcare sector through the Commission will be heard and will be understood. I'm also hopeful that there's an opportunity, as I say, for different parts of our society to come together. There are green shoots all over the place. The challenges, there are not enough of them, and we want to spread them, and we want more of them.
The Class of 2035 Commission has been a real eye-opening moment for me. I was overwhelmed by the quality and quantity of evidence that we already have, and struck by the fact that there is not good enough policy to work on that evidence currently. We're trying to raise what the government says is the healthiest generation of children, but what practical steps are we doing to do that?
By not addressing the issues and concerns that we have seen and that we've discussed in the Commission that we know happen in childhood, what we're doing is brewing the problems of tomorrow.